Hey everybody, it's Dr. Mark here from Behavioral Family Chiropractic, and this week we're going to talk about shoulders because your shoulder is the most unstable and movable joint in your body, and its wide range of motion is facilitated by four primary muscles and their tendons, which together we call the rotator cuff. And if your shoulder becomes inflamed or an impingement occurs, you may make the mistake of avoiding using your arm to try and help it heal. Now, it may surprise you to learn that controlled movement is actually one of the best ways to heal. Not moving your shoulder can actually contribute to more pain or even lead to something called a frozen shoulder. The most common source of pain in the shoulder is actually the tendons, and these tendons are actually what attaches the muscle to the bones in your shoulder. Now, you can have a couple different things go wrong here. There's a sac of fluid in there that cushions your shoulder, and that can become swollen and painful as a result of repetitive motion. That's called bursitis. If the tendon in your shoulder becomes inflamed, that's called the tendonitis. That makes sense. But if a tendon gets pinched between or under the bones of your shoulder, that can result in a shoulder impingement. Now, lifting overhead repetitively, which a lot of athletes do, especially CrossFit athletes, can cause an impingement, and you might experience swelling and pain. And if a tendon in your shoulder becomes torn, that's a rotator cuff tear. Your rotator cuff can become damaged due to overuse. It can be damaged because of injury. It can be damaged because of age. And tears usually cause pain when lifting and may be accompanied by a popping sound. Now, your shoulder and spine work together. And while it may seem like the two are completely different and independent areas of the body, research has shown that postural abnormalities can play a significant role in the likelihood of developing shoulder pain. Maintaining a full range of motion in your shoulder and in the spinal joints in your neck and your mid-back can actually help reduce the chances of experiencing shoulder pain. And what I've found in my office is that a majority of people that are having a lot of shoulder pain, especially athletes, relieve a lot of that discomfort and that pain just by increasing the mobility in their upper back. Now, if you've been living with shoulder discomfort or you're having difficulty moving your shoulder, take a moment to contact me for a complete evaluation of that joint. And we can work together with you to create a movement-based plan that can give you the best chance of finding long-term relief naturally. I'm Dr. Mark. I'll talk to you again next week.